Okay, delete.
I can cut it out. Okay, this is a follow-up.
Mhm.
So it's almost 5 months? Okay. The patient's had a 40-year history of pain. And there are situations where patients come in, as you've noticed with other videos posted here, that respond immediately, have absolutely no pain. Everybody's symptoms are different. However, her patients have been around for about 40 years. She's had many different difficulties and problems. And I'll let her tell you about her experience with the ATM2 and what's it doing for her. Give a synopsis of your history again and what kind of treatment you've had and surgeries and stuff, and then what your lifestyle was like and what it is now after using the ATM2.
Okay. My first difficulty came when I was a teenager, and I had fallen, and it resulted in my wearing a brace in high school for a couple of years.
Can't get up.
Oh no!
I'm sorry. Go ahead.
So that was the beginning, and at that point I was diagnosed with degenerative discs, that I was degenerating faster than most people normally do. So I started experiencing herniations in my 20s, and my back started to collapse sooner than most people. So I was seeing chiropractors, I was in physical therapy. In my pregnancies, I wore supports because of the weight of the children. So it was an ongoing, constant thing. In my 30s, it was recommended that my back be steel rotted, and I did not want to do that, so I didn't. And I continued just seeing physical therapists at this point. Most chiropractors at this point said they wouldn't touch my back because of how much it had degenerated. So we go forward, I guess about 1999, my neck collapsed to such a degree that I was paralyzed on my right side, my right arm. So they took bone from my hip and they put it in 3 of the vertebrae. I recovered from that very well. I had therapy, and I would say that was a very successful surgery, but it has limited my ability to move.
I'm leaving.
My second surgery was in 2004. I had laminectomy, and it was done in 3 different locations where the stenosis had fallen into the spine and also had collapsed. So they performed that surgery, and at that time also finding the growth. My recovery from that took much longer. And then in 2007, I started experiencing, pretty extensive arthritic conditions in my hands, in my joints, in my whole body. And then I was finally diagnosed also with fibromyalgia, which has compounded everything that I've experienced. So when I came to Mitch, I was in a pretty bad state as far as I was dealing about an 8-9 pain level constantly out of 10. And I would have episodes of neurological involvement that would bring me down, and I did not want to have any more surgeries. So we worked for a few months just to get me moving again. And at this point, I was also out on disability from my job. I was a counselor, and the pain had reached levels where I was unable to concentrate, and I was no longer able to function at my job at a worthwhile capacity. So we got me back into a state where I was bordering about a 6 or a 7 pain level, and I'm on different medications to help cope with the pain. So I felt I could do all right, but I continued to have episodes.